Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Taking Injectable Insulin. Introduction. Diabetes affects hundreds of millions of people around the world. Your healthcare provider may have informed you that you have diabetes. Insulin, along with diet and exercise, can be used to help control your diabetes. This patient education program will help you learn how you can control your diabetes with insulin. Diabetes. Insulin is a chemical hormone the pancreas makes. Normally, insulin levels in the blood change depending on how much glucose is in the blood. Glucose is a type of sugar the body uses as a source of energy. People with type 1 diabetes must take insulin every day. Treatment options. Diabetes cannot be cured. However, blood sugar levels can be controlled and kept within a normal range. When the blood sugar level is checked before you eat or drink, most people with diabetes will have results between 70 and 130 milligrams per deciliter. Treatment for diabetes varies from patient to patient. Your healthcare provider will work with you to choose what kind of treatment is best for you. If you have type 1 diabetes, your body does not make insulin. Patients with type 1 diabetes must understand their diet and take insulin. Patients with type 2 diabetes may not need insulin. Diabetes in these patients may be controlled with diet, exercise, and oral medications. However, more than 50% of people with type 2 diabetes will need to take insulin someday. The success of your treatment mostly depends on you. A healthier life is a balance between your food choices, your medicine plan, and exercise. Your plan may include insulin. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Insulin. Insulin is needed to allow glucose to enter the cells. All patients with type 1 diabetes and some patients with type 2 need insulin. There are several kinds of insulin. To understand how each kind of insulin is different from another, you need to know 3 words. 1. Onset. 2. Peak. 3. Duration. The onset of insulin is the time between taking the injection and when the insulin is beginning to lower the glucose level. The peak is how long it takes for the insulin to be working with full power. The duration is how long it takes for the insulin to be used up and no longer able to lower the glucose level. Insulin can be rapid acting. The onset, when it starts working, is 10 to 15 minutes. Its peak, when it is most powerful, is 30 to 90 minutes, and its duration, when it is no longer available, is after 3 to 5 hours. Novolog and Humalog, these are 2 types of rapid-acting insulin. Insulin can be medium-acting. The onset is 1/2 hour to 1 hour, and it peaks at 2 to 3 hours and has a duration of 4 to 6 hours. Regular and Humulin are 2 types of medium-acting insulin. Insulin can be intermediate-acting. The onset is 1 to 1.5 hours. It peaks in 6 to 8 hours and has a duration of 12 to 16 hours. NPH, Novolin N, these are 2 types of intermediate-acting insulin. Insulin can be long-acting. The onset is 1 to 2 hours with not much peak, and it has a duration of up to 24 hours. Lantus, Detamir, these are 2 types of long-acting insulin. There are also insulin mixtures where rapid-acting insulin can be mixed with intermediate-acting insulin. For example, 70/30 has 70% intermediate-acting and 30% rapid-acting insulin. Your healthcare provider will ask you to follow a special schedule of insulin injection. You will also need to test your blood glucose before meals and keep a daily log. This will help you and your healthcare provider know if you need more or less insulin and which kind. Drawing up one insulin. Insulin is measured in units on the 30-unit and 50-unit syringes. Each black line on the syringe is equal to 1 unit. 42 units on the 50-unit syringe equals 40 plus 2 lines. On 100-unit syringes, each black line between the numbers is equal to 2 units. 42 units on the 100-unit syringe equals 40 plus 1 line. There are 3 sizes of special insulin syringes. 3/10 cc insulin syringe when you are taking 30 units or less at one time. 1/2 cc insulin syringe when you are taking between 30 and 50 units at one time. 1 cc insulin syringe when you are taking between 50 and 100 units at one time. Gather the supplies: insulin bottle, insulin syringe, biohazardous waste sharps container, and alcohol swab pads. Check that you have the right size syringe and type of insulin. Check the expiration date on the bottle. Once it is opened, insulin must be used within 28 days. Wash your hands. If you are taking cloudy insulin, roll the bottle between your hands until it is completely mixed, or gently tip the bottle back and forth 6 to 10 times to mix. Do not shake the bottle. Wipe the top of the insulin bottle with an alcohol swab. Remove the cap that covers the needle by pulling it straight off the syringe. Keep the needle sterile. Once you have removed the cap, do not set it down or touch the needle. Take the syringe and pull the plunger down to the number of units of insulin that you will be taking. You now have air in the syringe. You will need air in the syringe equal to the amount of insulin you are injecting. Push the needle through the center of the rubber top of the insulin bottle. Push the air into the insulin bottle. It will make it easier for you to draw the insulin out of the bottle. Leave the needle in the insulin bottle. Turn the insulin bottle and syringe upside down. Pull the plunger down slowly to get insulin into the syringe. Be sure to get the right number of units. Look for air bubbles in your syringe. Air bubbles in the syringe mean that you will get less insulin. If there is air in the syringe, tap the syringe until the air floats to the top, then push the plunger of the syringe until all the air is out. Remeasure your correct number of units. Check the syringe to make sure that you have the correct number of units of insulin and no air bubbles. Pull the syringe out of the bottle. You are now ready to give the insulin injection. Mixing insulin. When you need to use 2 types of insulin for an injection, they may sometimes be mixed in the same insulin syringe, so you will need only 1 injection. Ask your healthcare provider to see if you are allowed to mix the 2 types of insulin. Using 2 types of insulin can help you keep your blood sugar levels in your target range. When mixing 2 types of insulin in one syringe, one type of insulin is always clear and short-acting. The second type of insulin is cloudy and long-acting. Gather the supplies: 2 bottles of different types of insulin, insulin syringe, cotton balls, biohazardous waste sharps container, and alcohol swab pads. Check that you have the right size syringe and types of insulin. Check the expiration date on the insulin bottles. Once it is opened, it must be used within 28 days. Wash your hands. Roll the bottle of cloudy insulin between your hands until it is completely mixed, or gently tip the bottle up and down 6 to 10 times. Never shake a bottle of insulin. Wipe the top of both insulin bottles with an alcohol swab. Use a clean alcohol swab for each bottle of insulin. Take the syringe and pull the plunger down to the number of units of cloudy insulin that you will be taking. You now have air in the syringe. You will need air in the syringe equal to the amount of cloudy insulin you are injecting. Push the needle through the center of the rubber top of the cloudy insulin bottle. Push the air into the cloudy insulin bottle. Pull the needle out of the cloudy insulin bottle. You will not draw the cloudy insulin out of the bottle at this time. Take the syringe and pull the plunger down to the number of units of clear insulin that you will be taking. You have air in the syringe. You will need air in the syringe, the same amount as the clear insulin you take. Push the needle through the center of the rubber top of the clear insulin bottle. Push the air into the clear insulin bottle. Do not pull the needle out of the insulin bottle. Turn the clear insulin bottle and syringe upside down. Pull the plunger down slowly to get the right amount of units of clear insulin into the syringe. Pull slowly to avoid getting air bubbles in the syringe. Look for air bubbles in the syringe. Air bubbles in the syringe mean that you will get less insulin. If there is air in the syringe, tap the syringe until the air floats to the top, then push the plunger of the syringe until all the air is out. Check the syringe to make sure you have the correct number of units of clear insulin and no air bubbles. Pull the syringe out of the clear insulin bottle. Clear is always measured first. Clear is often a smaller amount. Push the needle through the center of the rubber top of the cloudy insulin bottle. Be careful not to push any of the clear insulin into this bottle. Turn the insulin bottle and syringe upside down. Slowly pull down the plunger to get the total number of units you need. Be sure you have the right number of units because you cannot push any insulin back into the bottle. If you have more insulin than the total number of units you need, discard the syringe. You will need to start over. For example, 10 units clear plus 25 units cloudy equals 35 units total. You should have in the syringe the right number of units of clear insulin and the right number of units of cloudy insulin. The number of units in the syringe should be the total number of units of clear and cloudy insulin. Pull the syringe out of the bottle. You are now ready to inject your insulin. Injecting insulin. Insulin can be injected into the fat of the stomach area, the fat of the thigh, or the fat of the arm. Insulin injected in the stomach area works the fastest and in the thigh works the slowest. A member of the diabetic care team will show you where you should inject insulin. Insulin injections are not very uncomfortable. Insulin is injected in the fatty area under the skin using a small needle. Before injecting insulin, you should wash your hands and clean the area to be injected. Clean the skin area to be injected with an alcohol swab. Hold the fold of skin and push the needle into the fatty tissue. Push the plunger to inject the insulin. Release the skin fold. Remove the needle from the skin. Press your finger or an alcohol swab over the spot where you gave the injection. Make sure to have your diabetes educator go over the steps of taking an injection with you. The syringe and the uncapped needle must be disposed of directly into a biohazardous waste sharps container so that you or anybody else will not accidentally get stuck. Your town or state may have laws about disposing of these objects. Check with a member of your diabetic care team for specific instructions. How to use an insulin pen. Many people use insulin pens instead of syringes to take insulin. An insulin pen is a disposable, single-patient use pen pre-filled with insulin. An insulin pen looks similar to pens used for writing and comes pre-filled with the kind of insulin you need. You don't have to draw up insulin if you use an insulin pen. Check with your healthcare provider to see if you can use one. Preparing your insulin pen. Before using an insulin pen, check your healthcare provider's instructions to make sure the pen has the right type of insulin for you. Also, make sure the insulin has not expired. Make sure fewer than 14 days have passed since you started using your pen. Insulin is either clear or cloudy. Check with your healthcare provider about the correct color of your insulin. Wash your hands with soap and water. Your healthcare provider will tell you if you need to mix the insulin before using the pen. If you do, gently roll the pen between the palms of your hands 10 times. Preparing the needle. Pull the pen cap straight off. Put a new needle into the pen before each use. Remove the paper tab from the outer needle shield. Screw the capped needle onto the pen, turning it clockwise until it's tight. Pull off the outer needle shield. Save it for later when taking the needle off the pen after your shot. Remove the inner needle shield and throw it away. Priming your insulin pen. Priming your pen means removing the air from the needle and pen that may collect during normal use. Priming the pen ensures that the pen is working correctly. It also ensures you don't get too much or too little insulin. With the needle pointed up in the air, turn the dose knob to select 2 units. Tap your pen gently to send air bubbles to the top. Press the dose knob up using your thumb and count to 5 slowly until it stops and you see 0 on the dose window. You should see insulin at the tip of the needle. Repeat this until a drop of insulin comes out of the needle. Injecting insulin. Turn the dose knob to select the number of units you need to inject. The dose indicator window should line up with your dose. The pen dials 1 unit at a time. The dose knob clicks as you turn it. Do not dial your dose by counting the clicks. You may dial the wrong dose. A member of your healthcare team will show you where you should inject insulin. Clean the skin area to be injected with an alcohol swab. Hold a fold of skin and push the needle into the fatty tissue. Put your thumb on the dose knob and push it until it stops. Hold the needle in the skin and keep it still for 5 seconds before pulling out the needle. Check to make sure that you see 0 in the dose window. This means you have received the full dose. Pull the needle out of your skin. Disposing of the used needle. Carefully replace the outer needle shield. Unscrew the capped needle and throw it away in an approved collection container, Sharps container. Replace the pen cap. Do not store the pen with the needle attached. This could lead to leaking, blockage of the needle, or air entering the pen. Storing the insulin pen. Store unused pens in the refrigerator. Unused pens may be used until the expiration date printed on the label if they have been kept in the refrigerator. Store insulin pens you are currently using at room temperature. Throw away any pen you are using after 14 days, even if it still has insulin in it. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Insulin injections are very safe and not very painful. They can help control diabetes and prevent some of its complications. Remember to monitor your blood sugar and keep records to review with your healthcare provider about your injection dosage, type, and schedule. If you have any symptoms of low blood glucose, which is called hypoglycemia, or high blood glucose, which is called hyperglycemia, make sure to check your blood sugar and call your healthcare provider if you cannot fix the problem yourself. High blood glucose is more than 160 milligrams per deciliter before meals. A good blood glucose range is 70 to 130 milligrams per deciliter before meals for people age 59 and younger who have no other medical problems and are not pregnant. Ask your healthcare provider about the ideal blood glucose range for you. Low blood glucose is less than 80 milligrams per deciliter, or if symptoms like shakiness are present. Please carry sugar candies or glucose tablets. Take 3 to 4 if you have low blood glucose symptoms. Thank you for using Explain.